Hello, everyone. My name is Peyton Sayers, and my topic for this creative project was COVID 19. I chose to do it this way because I wanted to simulate what an online lesson looked like during COVID. So, the main points I want to hit today are giving you all a brief timeline of early COVID, how COVID affects us today, socially and mentally, and I will ask you all to share some of your experiences as well during lockdown, and I will share mine. So, let's get to it. Like I said before, in this presentation, I'm going to cover four things: what COVID 19 is, a brief timeline of early COVID events. I'm going to ask you all to share your experiences on life during lockdown, and I'm going to share some of mine. And then I'm going to talk about how COVID affects today. COVID reshaped daily life, school, work, mental health, and global systems. So I think it's important to understand what happened and how it developed over time. And that helps us understand why we're still seeing those effects to this day. So before I continue with my presentation, I think it's important to talk about what COVID 19 is. COVID 19 is caused by the SARS CoV 2 virus, which also stands for Severe Acute Respiratory Syndrome Coronavirus 2. The virus spreads mainly through droplets or small particles that infected people breathe out. These droplets can also land on surfaces, which can cause transmission when touched. Symptoms can range from mild things like fever, cough, or fatigue, but it also can be severe to like breathing problems and even respiratory failure. Early on, it was really difficult for doctors and researchers to predict how people would respond, which made the virus especially challenging to control. On this slide, I'm going to discuss some early events from December 2019 through January 2020, and I pulled all these dates from Matt Doden. So on December 1st, 2019, the early suspected COVID 19 symptoms are reported in Wuhan, China. In December 30th, 2019, Chinese doctor Li Wenliang warns fellow doctors about a SARS like virus spreading in Wuhan. In January 11th, 2020, China reports the first known COVID death, a 61-year-old man in Wuhan. In January 21st, 2020, the first U.S. case is reported in Washington state. These early weeks were a turning point in global health, even though most people had no idea how big COVID 19 would become. So now I'm going to talk about the global spread. Uh, this timeline covers February 2020 to March 2020. So on February 29th, 2020, the United States reported its first known death from COVID 19. Later, though, two deaths on February 26th were suspected due to COVID. In March 11th, 2020, the NBA suspended its season after a player named Rudy Gobert tested positive for COVID 19. Trump also banned travel restrictions from many European countries. In March 19, 2020, California Governor Gavin Newsom issues a shelter-in-place order for his state, the first in the U.S. Many other states soon follow. In March 26, 2020, the U.S. becomes the country with the highest number of COVID 19 cases. This is when widespread shutdowns and major lifestyle changes truly begin to happen for the world. So, this last slide is covering the last bit of early COVID events that we're going to talk about today. So, that ranged from April 17th, 2020 to August 2020. April 17th, 2020, in a series of tweets, Trump encourages people to protest their lockdown orders from their states, and many states began to reopen a few weeks later. In May 21st, 2020, the total number of worldwide reported cases of COVID 19 topped over 5 million. On July 7th, 2020, the United States reports a total of more than 3 million cases alone in the United States. On August 9th, 2020, reported cases in the U.S. hit over 5 million. Pandemic declaration. March 1st, 2020, the United States declared COVID 19 as a national emergency. On March 11th, 2020, the COVID 19 outbreak was declared a global pandemic by the World Health Organization, who you'll see later in my presentation under the name WHO. At this time, infections were rising in Asia, Europe, and the United States at an alarming rate. This led to major public health measures that we all remember, such as social distancing, travel restrictions, school closings, and the first major lockdown. And this moment in time officially marked the beginning of the pandemic that we all know. So for this portion of my presentation, I decided to go a different route. So for life during lockdown, I wanted to ask everybody what were their experiences like during COVID lockdown. Was it stressful for you? Did you enjoy it? I know some people enjoyed getting a break from like normal life, but some people felt isolated and disconnected. So I wonder, how did y'all feel about it? The mental and social impacts of COVID 19. According to Lou and Lin, the COVID 19 pandemic has caused serious economic and social consequences. Recent research also shows that the pandemic not only caused like physical health crises, but also triggered many psychological and mental health crises for people. The psychological effects include increased stress, increased anxiety, emotional exhaustion, as many people dealt with job loss, disruption of their daily routines, and isolation from family and friends. Socially, many people felt disconnected with their communities, but also struggled with loneliness. Many people struggled to adjust to the rapid changes brought by the lockdown and other safety measures. I know for me personally, being away from my family, I really didn't enjoy that. So I think that took a toll on me mentally at the time during lockdown. Now I'm going to talk about the economic impacts from COVID 19. The economic impacts from COVID 19 were just as severe as the mental and social impacts. A quote I got from the World Health Organization states millions of enterprises face an existential threat. Nearly half of the world's 3.3 billion global workforce are at risk at losing their livelihoods. This was seen through widespread business closures, especially small businesses, and increased unemployment claims. Many families struggled balancing remote work, covering bills, and dealing with shortages in essential items such as water, toilet paper, baby formula, hand sanitizer, things of that nature. And communities with lower incomes were hit extremely hard. Like places in Appalachia, they got hit really hard when COVID hit. They faced greater financial insecurity and fewer resources to help them recover from that. Now I'm going to talk about vaccines and variants from 2021 to 2023. In the late 2020 and into 2021, COVID 19 vaccines became more widely available, which helped reduce the severe illnesses and hospitalizations as more people were vaccinated. Despite progress vaccines made, new variants such as Delta and Omicron still spread rapidly and cause additional waves of infections. These new variants emerge because viruses naturally mutate as they spread. So every time someone got infected, it would make a copy of itself, and sometimes it would make a small change in its genetic code. These surges forced schools and workplaces to adjust to updated guidelines, safety measures, and changing levels of risk. Between 2021 and 2023, we entered a transition period where people learned to manage COVID better through vaccines and boosters. Now I'm going to discuss COVID today in 2025. Many people today continue to experience long term symptoms such as breathing problems, fatigue, and difficulty concentrating, which is referred to as long COVID. One of the symptoms of long COVID that I thought was interesting was brain fog. And people stated that it wasn't them just being tired and distracted, it was them feeling that they were mentally slower. They had trouble focusing on things, they forgot things easier. They said like easier tasks that they could do like really fast before was really hard for them now. COVID has permanently influenced mental health with higher levels of stress, anxiety, and emotional fatigue. I think I see that a lot because you don't see a lot of people having conversation anymore today. And I think COVID was a big part of that. Workplaces and schools have changed significantly, such as more flexibility in remote work, hybrid schedules, and increased use of technology. Daily life has shifted for many people, myself included, such as people maintaining new habits around hygiene and balancing personal well being and illness prevention. To wrap this presentation up, COVID 19 has made major and a lasting impact on our world. From its emergence in late 2019 to the global spread, the pandemic reshaped daily life, work, school, and health systems. The lockdown created major social, emotional, and economic challenges. Even as vaccines became more available, new variants came to affect communities worldwide. People today still face long term health effects, ongoing stress, and changes in their daily lives. I believe it's important to understand the timeline of COVID and its impact to recognize how much the pandemic changes our society and how it will continue to affect us today and in the future. Thank you all for listening. And here is a quick look at my references that I use to help make this presentation.